Thank you for choosing CHOC Children's Surgical Services. All patients should arrive at the hospital 2 hours prior to the surgery's scheduled start time. Patients should park at the valet stand outside of CHOC's main entrance located on Pepper Street just off of Levita Avenue. The valet service opens at 5:30 in the morning and is complimentary for the car the patient arrives in. Parking is free for the first 24 hours of a patient's stay. Visitors should park in the CHOC parking structure. After parking, patients and their families proceed to our lobby to the admitting desk. One of our associates will admit the patient to the hospital, assist with the completion of any last-minute paperwork, and escort the patient to the preoperative unit. The preoperative unit, also known as the short stay unit or pre-op unit, is where all patients are prepared for surgery. Upon entering the unit, each patient is greeted by the preoperative unit secretary who will assign the patient to the appropriate room. The secretary is a great resource for all non-medical questions while in the preoperative unit. All patient rooms have a bed, sink, guest chair, and television. For their safety, children under the age of 4 will be assigned to a room with a crib-style bed that will also be used as transportation to and from the procedure. Once settled into the room, the preoperative nurse will review the patient's health history, confirm the procedure and the time the patient stopped eating and drinking, and discuss what to expect for the rest of the day at CHOC. The nurse or a nursing assistant will take the patient's blood pressure, temperature, heart rate, respiratory rate, and oxygen level readings, as well as his or her height and weight. After a final discussion with the operating room nurse, surgeon, and anesthesiologist, and having signed all of the necessary forms, the parents or legal guardians will accompany the child to the doors of the operating room. While in surgery, the child's parents or legal guardians will be escorted to our family room. Each patient may have up to 4 visitors, including his or her legal guardians, in the surgical waiting room. No food or drinks are allowed in the waiting area at any time. Although we do offer a variety of toys for children in our waiting area, we ask that families make alternate arrangements for other children so that the family can focus on the child undergoing surgery and reduce the risk of spreading illness to our patients who may wish to play prior to their procedures. After surgery and once stabilized in the recovery room, also known as the PACU, one parent or legal guardian will be allowed to visit the patient. All other visitors may rejoin the child when he or she is admitted to an inpatient room to spend the night or return to the preoperative unit to be discharged home. At CHOC Children's, we are dedicated to providing family-centered care and making the surgery experience a positive one.